Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, good afternoon, everybody, and welcome to Health Care Quality and Risk Matters, the September 2025 edition. And my name is Gary Bierce, and I'm being joined by Rob Santamore. We are your hosts for this episode. We want to thank you for chiming in with us. We'd ask you to go ahead and get into the chat. Tell us where you're from. Like to know more about you and some of the thoughts you have on today's topics, which is artificial intelligence. We're going to talk about artificial intelligence for healthcare today. If you're new to our episode or to our show, we have a very interesting format. Rob and I begin normally with an incident of the month. We then follow that by a time of Q&A that we call Minute Matters, which we're restricting each other to a minute to answer questions on the topic of the time. And then we try to go to your questions and comments and try to cover all that and wrap it up at the end of the show. Today, we're doing something new. We're not going to be ending the show hard and end it normally. We're going to let you know we're ending the main podcast, and then we're going to merge right into our after show today. So if you want to stick around for our after show, please do. Warn you, though, we're going to be talking about Aperitisoft Healthcare, our product, and how we can be applying that to the topic of the day. So if you're interested in learning more about that, we would definitely invite you to stick around. I think you'd be surprised what you hear. So anyway, enough of my babbling, Rob. How about we begin with the incident of the month?
Good afternoon. So the incident of the month, there were sadly many examples. So from a very high level, we wanted to share there's the concepts around AI and what it can and can't do versus what it should or shouldn't do, right? Just a general overview. Between 2004 2005, there's been multiple lawsuits filed because of tragic cases where AI has encouraged, especially vulnerable teens, towards self-harm or suicidal ideation, or unfortunately taking their own life.
This is the last 2 years.
This is the last 2 years. Okay. As far as anything more historic, I didn't pull any of that, but just in the last 2 years, there have been multiple cases that have gone in front of judges, citing things like failure to redirect for help, right? So somebody's sharing harmful thoughts, distress to an AI chatbot of some kind. The allegation is that AI chatbots are maybe even encouraging or validating these harmful thoughts, or some of these, very sad thoughts that these kids are experiencing in their brains, and not redirecting them for appropriate mental health to get them to healthcare. There's to get them the help that they need. And then in some cases, even citing things like emotional manipulation, suggesting that there's these kids that are already susceptible to there's harmful thoughts, are being exploited by these chatbots. And this is just so sad to read and so horrible. And for all of those families that experienced all of this, and for all of those people that experienced this, I'm so sorry that the technology did not help, and that it made it worse. Just terrible for all of you.
And we felt, folks, that this incident was important to put out here first, because as exciting as it is about AI and what it can do for society, if you're old like me and you remember Lost in Space, and the robot would say, warning, Will Robinson, danger, 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 because we're dealing with something that has no feelings, it has no empathy. As much as it might sound like it does, it's just a machine that is running off algorithms and different coding models that produce incredible results on research, but also can have a lot of mistakes based on that programming.
Agreed.
So what this is telling us then, Rob, is that as much as we've got this incredible thing that can help advance healthcare, it has an enormous amount of risk and danger associated with it.
Agreed. Unfortunately, when you have something that can produce harm, right? And in these cases, obviously, it did. And producing harm, in my mind, can be through lack of redirection to help, right? That it's not making those smart, empathetic decisions that a human would make to make sure that these people got the care they deserve and that they needed to be okay.
Right.
And I agree. That tells us that healthcare is not inherently ready. There's to let AI run the healthcare world. It can't keep our people in the community safe. So it's not ready to keep our hospitals safe.
Right.
And it's not ready to, frankly, keep our hospitals in business. Obviously, the people are more important, but thinking through how our hospitals keep their doors open to help people, we're just not there yet. And I hate reading incidents like this. And as a community, there's both on the operations side and clinical side of all things healthcare, we need to really think through the application of AI. Where is it okay? Where is it not okay? Where is it ready? Where is it not ready?
Right. And we put together a great diagram for this. We've been trying to help you, our audience, to be educated on things and be able to have something practical that you can bring back to your own organizations. Hopefully, you've also gone online and found our newsletter, our online newsletter through LinkedIn, and we wrote a newsletter on this same topic using this graphic to drive that. So, please go out there and subscribe to it if you haven't already, and download yourself a copy of the newsletter. So what we've taken an approach of is that there are three broad applications within the healthcare quality and risk world where you could use AI. And what we're going to talk through here is on the left side here, how does it work well? And you can rely on it to give you some very good input, a value add that you didn't have before.
Mm-hmm.
The left side of the screen. The right side of the screen is where it's going to fall short and where you're going to really put yourself at risk if you rely on it. So, Rob, why don't we begin? Why don't you start with the quality management component of quality and risk and kind of walk through from left to right what's good, and what's bad and ugly on the far right.
Yeah, and I can even say some of these things where I think there are value adds, and we as a team in talking to our creative developer that put this together for us, we agree. We've used these tools this way. Analytics, trend spotting, drafting research. There's AI there's a great application here, right? It does speed up our work. It allows us to it allows us to use our experience, our human brains, to input information, based on our experience to get good information back, right? Including here's a bunch of data, help me with some good, there's analytics around this. There's help me trend some of these things that I'm tracking. There's help me get some good information that is peer reviewed and smart. There's to grab, there's research and help me draft it. But where it doesn't work, is helping our organization or our clients' organizations adopt a policy, formalize the process. There's and understanding cultural nuance. And those things take the human brain. You cannot adopt a policy because you don't know your internal structure. You don't know, there's your internal skills, your internal, there's talents and culture and all of those things that come with policy adoption, right? Formalizing process, very much the same thing. I can walk into one hospital and the let's say ESI throughput for the emergency department. I want to evaluate that and I want to change that process. It's going to work so differently from one hospital to the next in the same exact town. So I can't have a standard process from hospital to hospital because I have different providers. I have different services that I'm providing. And AI just cannot formulate a smart plan that is universal. It can do a universal process, but it can't do those nuanced processes that take the culture of the organization into account. And that's the quality management, the culture, right? A culture of quality. AI doesn't enhance your culture. It doesn't help make sure that your organization feels that they are an organization that cares about quality, that they've adopted quality, that they are quality. It is very simply a tool to gather more information to support the human brain.
Yeah, the human brain is limited, right? It can only research so quickly.
Yeah.
So with AI, we can speed up this process, right? We can enormously speed up the process. But at the end of the day, humans need to make decisions. You can have AI draft a policy for you.
Yeah.
You then just go and assume that it's accurate and adopt it. It could be some really silly things that it puts in there that make no sense whatsoever.
Right? I'm waiting for the day, Gary, that we walk into there's clients building, or they email us their policies, and we just say, you're not doing any of these things, or none of these things are appropriate, or these things are clearly, like you said, silly. And we're just going to know that they're written by AI. And
yeah, all of us have gotten spam emails that were written by some AI bot.
And I can tell right away.
Oh yeah, absolutely. It has one little snippet out of context that that is trying to make it sound like that person studied your website thoroughly, and it wasn't at all, right?
Yes.
So the word, I think, in nuances is a great word here, right?
Yeah.
There are nuances in our culture. There are nuances in processes. There are nuances in human behavior that AI just does not pick up on.
And that is the biggest thing for me. And I love that you said that, Gary, the nuances in human behavior. When you're thinking of policy and process, you are thinking of quality controls. So, right, policy and process is, how I'm meeting my standards, what I'm exactly doing, how it's going to be measured, right? All of those things go into it. And the quality controls highly depend on the culture of your organization and the abilities of your people. And the infrastructure your organization offers. And so you can't put in a quality control of a specialty alarm that your organization doesn't have.
Right.
You can't put in a control of a 100% quality assurance check if your other policy is that you will do a 10% sample size, right? So there's all of these things that need to be taken into account that humans just have to know. You just have to know that these are things that we can't do at our hospital. Gary, you can do them at yours, but we can't do them at ours.
That's right. There you go.
And our brains need to do that. AI is not there.
Well, let me pick up the risk and safety management one here. I really think AI is going to be a big plus in this area. I mean, we can go out. I mean, I ran into recently, Rob, a company that has developed a way to quantify cyber risk in any organization. And it all began by a U.S. Cyber Command contracted these quant experts to go and figure out what the risk was and impact of risk to the United States of America. Well, they are accessing dark web sources. They're going in and finding data where it would take us a long time to do all this research. But the AI could go in there and say, okay, based on my scan of the dark web, a data record, a personal PII data record is worth $9. So if you've had 20,000 records stolen from your company, then do the math. That's what the loss is. Things like that. That's powerful and that's wonderful.
Yeah.
But what it could not tell you is, well, what's my real minimum effect based on my organizational culture, how my people operate, what my real exposure might be, tendencies. It can't tell you that, right?
No.
It's pure data evaluated with pure output. That's what AI is very, very good at, particularly big data, right? So now look, I could go in and we can look at trends of falls across hospitals in the entire Northeast and see what the trends look like, right? Now, does that mean that's my trend? No. That means that's what everybody else is doing.
Right.
So now I have to look at my own and say, okay, well, how does that stack up against everybody else? Now, you can teach AI to do that, right? Look at everybody else and look at me and do the comparison. We can use it for that as well, right? But what is it giving us, Rob? It's giving us data from which a human being, you, Rob, can then say, okay, interesting. Based off of this, you can make some decisions, right?
Yeah. But you can make some decisions. Yes.
Right. You make the decisions. Same with like scoring, right? In Aperitisoft, of course, we have a very specific methodology that we deploy around how you would score or risk rank incidents when they occur in a hospital. Well, AI would be wonderful to be looking at some of this stuff, right? To go and again advise based off of a data set how that really should be thought of, or how you should think about doing the scoring. But again, who's doing the scoring? You are, right? Mm-hmm. Same on compliance, same type of a thing. It could scan to do checks to see where you might be vulnerable using automation. All these things are wonderful. But now you get into a real problem when you're trying to make conclusions around context. So you have a specific fall, you're going in as a human and you're evaluating the scene and everything that's there. Mm-hmm. AI is not going to be able to do that for you.
No. And there's so many nuances back to that first word on evaluating those things, right? Like a fall isn't a fall, isn't a fall, isn't a fall. Everybody in healthcare knows that there are 1,000 different kinds of falls. There's all of them have a different risk to the patients and to the facility and to the providers. And it is important to understand the nuances of those, to know how to truly risk assess those to protect your patients. Yeah.
It's interesting because what we're really saying here is you can't think of AI as being another human being. It's not.
No.
Right? Is it a magic automation? Yes. It's incredible the things that can come out of these different algorithms. But pinpointing the root cause, it will give you ideas of what the root cause could be. Mm-hmm. But you need to investigate, boots on the ground, look at the scene, understand everything's there before you can actually pinpoint the root cause. Maybe AI gave the right suggestion, but
it might have
made the decision.
But it's also going to say the root cause of every fall is gravity. So that's
possible. That is possible.
Which is actually not untrue. Gravity is a root cause of a fall. However, it is not something actionable. And that is what is really important about adding the human brain is what is something that we as an organization, there's care team, mm-hmm. there's have control over. What things can we do to prevent harm? and we can't do anything about gravity. There's not a single thing that we can do. And so that is
Yeah.
not the root cause that needs to be documented. But now I can't wait to see the first report we get from AI where the hospital is just like, oh, we're doing this action plan
On gravity.
on gravity. Then that
We're
would be
looking to invest in anti-gravity devices for the elderly in our hospital space.
And
Yeah.
honestly, couldn't keep the patient safe. But you know what? The gap analysis would be very interesting because how do we keep them from going into space?
Yeah, right.
Right?
You're creating a risk. That's right.
Right. So there's again the nuances of these controls.
But I guess the last item here on the risk and safety is making any safety decisions, right? You can't. It can make again suggestions, but it can't tell you what your action should be. And how you should be managing this whole program. So, I mean, a theme is building here, isn't it, Rob, as we're going through this?
It is
a big theme. Why don't you tackle the clinical practice side? You're expert there. How does that play out with AI?
I would love to. Same general concept, right? It can offer ideas. It can offer information for you to come up with a large set of differentials, right? There may be a set of diagnoses that you did not learn in med school. There may be a syndrome or a disease process or something, a unique pathology that you did not think of. And because you're a human and you can't compute all of that information across the entire internet, right? So this may give you a much more significant differential list. Which would be wonderful for you as a doctor to work off of. And come up with your diagnosis. And
so speed to diagnosis is greatly improved by having some suggestions thrown out at you.
I totally agree. And that goes right into that diagnosis research, right? So here's the diagnosis. I need to learn more about this. I didn't even consider it in my differential. Help me find some good peer-reviewed scientific information that I can not only teach myself, I can get the right consults in that are experts in the space. I can provide more information for my patient. I can treat them better. I can collaborate with pharmacy, right? That information that it's adding for your brain to interpret and then there's move down the care, clinical course of care, is a huge value add. Again, you don't have time to sit there and sift through. There's textbooks. I remember the day back when I went to school, there's doctors are still sitting there going through the physician's desk reference book, which I'm pretty sure behind me somewhere I actually still have one.
Yeah.
And so like literally going through a book, there's at the nurse's station, like looking through. You don't have to do that anymore. And because you have tools like this, and that's great because it does speed things up, to your comment earlier. And being fast-paced in healthcare right now is extraordinarily important.
Well, the whole speed thing. I mean, we talked about this last week. I think it was that. What if you got that patient that, oh my gosh, you're banging your head against the wall. You can't figure out what's going wrong, right? You keep testing different things and they're coming back negative. You're not getting any positive results. So what do you do? Well, go to AI. I've tested all of this. These are the symptoms, right? What else could it be?
Yeah, give me a huge list of differentials.
Yeah. So now you're back, to the differential side of the equation because AI directed you there. Now you do some new testing. Boom, you start getting some positive results. Now, why is this so important? Time. When someone's really sick, the longer they're sick, the higher probability is they're not going to recover.
Well, yeah. And if you have to wait for your colleague who you think is going to know better, there's to come into the office on Monday. Yeah. Or even worse, and this one I have a very strong personal feeling about, just saying, well, I don't know, let's discharge you and hope your PCP will follow up with you. And because that happens too. I've read it in lots of, there's unfortunately both legal cases, and incident-based cases. Like those are not great outcomes when we just dismiss because we don't know. Right. This may help with that. I don't know what's going on. Maybe it's nothing, but I don't know. just go follow up with your PCP.
But the
And
important thing is you're testing the ideas. You're not
yeah,
taking them verbatim, right?
yes, it
And
is
you're
supporting your
following.
decision, not making the decision.
Yeah,
Agreed.
yeah,
And that's to the point where it falls short. Diagnosis, prescriptions, there's patient triage. It should not diagnose. It should not write the prescription.
exactly.
Can it help with those things? Yes. Hey, I just did my culture and sensitivity. What's the most appropriate antibiotic for this bug? Great. Here's the 3 that it gives me. I can now choose as the doctor to do that if you're the doctor. Wonderful. But you need to be making the decision.
Yep.
Because you don't know everything else going on with that patient. And even if you put it in, what else are you missing?
Yeah, one
And
day we might be the Star Trek, right, with the tricorder, and you scan somebody, it says they have such and such. Computer, so and so has such and such. What should I do? And then they do it, right? That might be one day, but it's not now.
Yeah, so last year my daughter had an ear infection, and I get to the pharmacy, and the doctor had already talked to the pharmacist and said, nope, there's not this drug, not this drug, not this drug, because those 2 were collaborating. There's over what was best because there wasn't the liquid form left because there was no antibiotics at that store at the time. And so there's a pharmacy to physician conversation. There's about what is best, not just what was left next on the list. I loved that. I loved the care that my daughter got. There's confidence that I felt in giving my daughter a drug that she had not had before, right? Be like, oh, she's not had this antibiotic. There's a little bit of nerves with that, especially if you're very risk averse like me. And so those are things that AI can't do. And on that, patient triage, I have heard a lot about AI and patient triage. So here are the 5 symptoms that my patient is presenting with. You know what, that's fine. Just go ahead and check them in the waiting room. And we'll get to when we get to them because they are a very low acuity, low risk patient. But there's that one thing that you're missing, and that is one, intuition. So I guess 2 things that you're missing. One, intuition. And then 2, back to that nuance piece, right? So something that seems like a sinus infection, is maybe something you're just going to tell them to sit in the waiting room. But then you see them turn their head a little weird, or you see them in their body posture is just slightly off. AI is likely not going to pick that up. And then your brain might say, hold on, I would like to assess your back and your head a little bit more because you didn't report that as a symptom, but I can see that in those very fine motor movements that my brain picked up tells me maybe you're at risk for meningitis because you're in that danger zone of infection. You've had it for 12 days. And you're having these like weird pain movements in your neck and head.
Yeah.
I'm concerned about meningitis. Might I be wrong? Absolutely. But
you hope
is
you're
AI
wrong.
going to, but
wrong.
yeah, right. Yeah. But is AI going to pick that up at all? They're not.
But in triage, that could be a difference between life or death.
Literally, yes.
Or somebody having a handicap the rest of their life.
Absolutely.
Right?
And so, I mean, those hours in the waiting room, people die in hospital waiting rooms in the ER. There's every year. So many people die in the waiting rooms of hospitals every year. And that is awful. And I think that the people doing triage are good people. They are smart people. They are doing the right things for the right reasons. And so I think that AI can help to an extent with research and getting better information about triaging, but not triaging the patient. And I'm just looking at the time period.
For a half hour already, Rob?
I know. I feel like we could talk about this forever.
I know first of all, it's exciting because this new technology, we're going to find the cures of cancer and autism and Alzheimer's and, you name it, right? Because AI is going to help us find it. Okay. But on the other hand, it's not the magic wand. Doctors need to be doctors, nurses need to be nurses.
Agreed.
Just look at this as a power tool to use them to use to do their job better. That's really what we're saying here. We have a lot to say in the after show about this. Before we do that, hey, I see Angel is on. Thank you, Angel, for joining us from Houston, Texas.
Hi, thanks for joining.
Yeah, thanks for joining this afternoon. Do we have any questions, comments from the audience that we can address before we move on to the after show?
It looks like anything that came in, we have already just organically addressed as we went through. Sorry for anybody that we missed in real time as we were going through. We were a little distracted by the excitement around this conversation. And Gary, I love how you ended it with doctors need to be doctors and nurses need to be nurses. Yeah. Because you're right. It's the nuances of the human brain that allow good quality care. And AI is a tool to assist, not to take over.
Exactly. I mean, if you think about it, Rob, in many ways, as they're coming up with wonderful new equipment to help diagnose things, from the MRI machine to CT scanning to what AI is just another tool. It's just another thing to boost the medical industry. And we shouldn't think of it as being the magic bullet. It's not.
Agreed. It's just a tool, like the computer. Right? We added the computer, we added the CT, we added the MRI. I love that analogy, Gary.
So Angel makes a big suggestion to anyone listening. AI data governance is critical. You need to start it right now if you haven't already. And thank you, Angel, for that comment, because that's exactly what we're saying here. Mm-hmm. Danger, danger, Will Robinson. If you don't have governance around this, proper procedures and protocols, you're going to put yourself in some significant risk.
Data governance is already a struggling part of healthcare, right? So adding AI to a data set that already is struggling foundationally is ever more important. I couldn't agree with you more, Angel.
Any other questions or comments from the audience you can see, Rob?
Not any new ones, no. But I am ready to jump to the after show. If anybody...
Well, one last comment before you do that, if you don't mind. Yeah. If you are interested in this graphic right here, please just send us a note to insights at aperitosofthc.com. That's insights at aperitosofthc.com, and we'll get you a copy of this as soon as we can. Again, go to our newsletter. This graphic, as well as a nice little paper written around it, is all right there for your use. So feel free to go out and subscribe. We'd love to have you there. Please like us out there. Share this podcast with your friends. We like to build out our audience as wide as we possibly can.
And we hope to see you all at the after show in about 10 seconds.
We're going to move the after show right now, folks. So the topic is going to change. And we're back again. Now for the after show. Oh my gosh, Rob, the amount of risk that exists with this is staggering to me. And being a risk guy, Angel's comment during the main show is spot on. I would add to Angel's comment, you need to do a thorough risk assessment of how you're going to deploy AI in your organization.
Mm-hmm. Start with your start with that baseline. Where am I? There's so many of our clients that we have worked with over the years complain about their data, about their general just operating information, right? At a very, very high level. Starting with
Can you take down the graphic for a second there, Rob?
Yeah. What's that?
Take down the graph.
Yeah.
There we go.
And starting with just like you said, a very smart risk assessment. Here's everything that we have. Mm-hmm. There's where are my vulnerabilities? Where are my accuracies? Where are my deficits? Where's all the good, the bad, and the ugly?
Yeah.
And we just don't have that. And
what are my risks, right? I mean,
yeah,
you put in AI, what are the bad things that can happen? That's predictively. Remember, we always talk about healthcare is so reactive, right? Let's get proactive around this. You have a
yeah.
plan.
We have a whole
You
podcast on proactive versus reactive, and
yeah,
what a great time to be proactive because
absolutely.
AI is coming. It's here. It's already doing things. This is no different than when computers were coming.
Yeah,
And computers came in and they changed everything. And
yeah,
now AI is going to change everything.
yeah.
And we need to be ready. And I think that we didn't do an amazing job of being ready for computers because in my career, and I've only been working there's for 25 years. So just in that 25-year span of time, I was completely paper. There's then half and half, then tried to be completely computer, and then almost immediately found problems and paper reemerged to fill the gaps. There's because we tried to transition and we didn't even realize the gaps that were created.
Well,
And
this is really fascinating because I mean, here we are at the precipice of a major technological leap, and you have shared with me numerous times when it comes to this type of stuff, healthcare is way behind the curve.
so many years behind almost every other advanced
So
industry.
think about it. If you're in healthcare quality and risk, this is a huge opportunity for you.
Yeah.
Reevaluate the technology that you have and start thinking about how do I upgrade? How do I get a paradigm shift out of my technology to help me with my job? And I'm not going to go on and on about how the senior leadership should do a better job of connecting the dots with quality and understanding how it's a money producer for them.
Oh, yeah. I will try not to go on and on about that too, because
Because we'll probably go off for another half hour on that alone. But if you've got the right technology, you're putting yourself in a position there. We at Aperitisoft Healthcare are not just about incident management. We're not just about creating CAPAs or giving you a way to document policies. We're doing all of that, but we're giving you a tool set that allows for you to deploy technology on all of them, including being proactive on a risk assessment around AI deployment, including being able to get you ahead of the curve on regulations before an audit happens.
oh, and wait for the regulations as regulations roll out around AI use.
And our roadmap, we don't have it in the Aperitisoft Healthcare yet, but in our roadmap, we want to bring AI in, and we want to have AI be that tool for you, just as we described in our previous segment. And
Yes.
so we would implore you to take a hard look at the technology that you're using, and then now start to think about assessing risk and having a technology that can help you. And certainly we can do that.
And there's already a huge deficit in the general healthcare community. Obviously, some do it better than others. But the deficit is around understanding how to do a risk assessment. The understanding is what there's information can be brought in, how it can be aggregated, interpreted, and acted on. And frankly, how do you track it all? And when you have there's 5, 6, 7 disparate systems, and then you have 3 different teams doing that work. There's that are all in completely different service lines and they don't talk to each other. You're not going to be able to make a smart, comprehensive decision that covers the entire impact of AI. There's AI again doesn't take the nuance of your organization into
That's
account.
exactly right.
And if they don't take the nuance of your organization into account, you need to figure out where your organization is without AI first.
Right. Yeah.
And that is, I would say, in my opinion and in my experience, there's not possible with what I have seen out there now. The other platforms, um, sometimes the organizational structure, they don't allow for that full culmination of data, right?
Yeah.
All of the aggregate quality, risk, and compliance data and what that means to patient outcomes, to revenue. There's the next phase in healthcare. There's We don't know what that is when we don't do it well because we don't have appropriate systems to do it.
Right. This is interesting because, I mean, yesterday, if you would ask me, Gary, what do you want to talk about in the after show, I wouldn't have come up with this one. But we have talked time and time again that terminology, like the word,
Yeah.
like the word risk assessment, is different in so many different industries.
Yes.
So that when we say something like this, how it processes into the brain of our healthcare friends that are joining us today could be completely different than what I'm thinking, or maybe even what you're thinking, right?
Mm-hmm.
Now, that process is fairly universal on how you do risk assessment, but people don't realize it. You know, they don't realize that there is an uncertainty around outcomes. So if I'm expecting a certain thing from AI, okay, there is a bell curve around that expectation of what really is going to happen. There could be incredible results from deploying AI, and there could be some pretty sad results from AI, right? So,
Agreed.
so the substance of that uncertainty, we at Aperitisoft Healthcare like to call a probable risk event. An event, something happens, like teenager commits suicide. You know, I'm being on the extreme. You know, that was what we were talking about in our main show as our incident of the month. But it's things like that. Somebody dies, misdiagnoses, things of this nature are events that all of a sudden put a negative connotation and result from AI. Positives would be got cured of cancer, figured out a fast way to do a joint replacement, right? You know, we can go on and on, right? On the positive side. The idea behind a risk assessment is to identify all of them, understand what the root causes are to those events happening, understanding what the impacts could be if they were to occur, and then to evaluate them using the tools. Like we have a Monte Carlo simulation engine will allow you to run 100,000 simulations on those scenarios and give you some output of what the results would look like, you know. And then now you can say, oh my gosh, this is very serious event over here, you know, way outside of our risk appetite. And there's another 10 to go with it. We need to do corrective action plans and preventative action plans around these things. Right now, I guess they would all be preventative, technically. Preventative action plans around all of them right now to get this, you know, make sure we have the right protocols in place and AI works for us. Well, guess what? You ask anybody out there, what tools do you have to do it? They got zero. You work with Aperitisoft Healthcare, you're in good shape.
Agreed. And it does add to culture when you have appropriate and smart tools. So when you have a tool like Aperitisoft Healthcare and you're trying to create a culture of quality, a culture of risk, there's people engaged and involved in giving good data out. And start to get people to speak the same language. And that's what you were saying at the beginning. People don't even say the same things and mean the same things. And because there's a whole bunch of different ways to describe the same thing using the same word, but different words to describe all the same things. Like none of it makes any sense. I remember about 5-6 years ago, I got a recruiter reach out to me and asked me if I would come run their risk department. And so talked through the role with them and what that would look like. And they kept describing a patient admission as a risk. And I was like, so I think that you're talking about like HCC data, not risk management as far as anything else. You're talking about like patient like chronic disease, like department visits for the emergency room, infections, diabetes, like that type of stuff.
Yeah.
And they were just like, oh, that's not what it says here. They were like, it's just about like hospital admissions and like device utilization. And I was like, that's HCC risk data. That is an entirely different set of, that's a whole different thing. And so even the recruiter, the hospital didn't even know what they were trying to recruit me for. Because they were just using a word inappropriately, because we just haven't figured things out. And back to Angel's comment about data governance, there's just general like policy governance, right? Like what is our dictionary? What is our communication? And Angel actually just dropped another comment. There's about agreeing on HBA for all attached AI tools is critical. There's absolutely. There's Angel states, I have helped several healthcare entities identify and implement or activate AI tools in their organization that place them at risk. And I could not agree more. Entering PHI into an AI tool will void there's any of those protections. Agreed, because we're not there yet. AI is too out in the open. It's too open in general. It's not locked down the same way that like an EHR is. And we don't know how to use it for patient level information very well. And I love the support in this comment, because yes, implementing AI, unless you have good data governance, there's baseline established with good risk assessments with smart tools, you're going to create more gaps, right? Like we said in the beginning of the middle of our main show, you identify the gap of the root cause analysis says it's gravity for falls as the root cause. Then all of a sudden it's space age. So now we've developed, there's anti-gravity beds. Well, our patients are floating around in space. And the thing is, like, I know we're joking, but we're not really, because although that particular incident won't happen, hold on, knock on wood, that particular incident likely won't happen. Things like that will happen. We're going to identify things that we have no control over because there's an understanding of humans and what we can and can't do. We are then implementing corrective actions that don't allow for correction or prevention. Of the risk incurred in preventing the risk from happening again, or risk.
Here's another way that AI could be very helpful. Say you are applying AI to your own data. So you're looking at all the different types of incidents that have been reported over the last 10 years. Okay. And AI is asked to identify which events should be expected to occur, with a high degree of probability in the year to come.
Yeah.
It could give you a really good suggestion of that. That doesn't mean it's a complete decision, a complete selection of that, right?
Right.
You might say, well, you missed the couple, or what have you. But it could definitely speed up the process of being able to do things like that. But you see, what we're doing here right now is we're talking about, if you truly want to do an analysis on AI, you can do it manually. You can get out Excel spreadsheets. You can be trying to do things like that. But you really need to have the right tools to manage this kind of thing. And
I agree.
And maintaining it, right? You want to be able to monitor through that you've done all the things that necessary to bring governance around the deployment of AI.
So I'm embarrassed to admit this, especially now moving into like the tech space later in my career, but my first, and I'm going to use giant air quotes when I say risk assessment, my first risk assessment was me printing out every incident that had occurred the prior year. And I rented one of our biggest conference rooms, and I labeled incident types. and I started to pile the incidents and papers and sorting them. And I
into
was just like,
buckets.
because there was no like export to Excel, right?
Yeah.
So like it couldn't even really, other than sit at the computer and like count them with like telemarks.
Right.
This was the most efficient way in my brain. And I mapped them all out, and then I figured which ones were most likely to happen just by quantity from the year prior. And I didn't take any potential changes.
Better than nothing, Rob. That's better than nothing, but that's not proactive.
No, it's just all it is just reacting to any type of preventative action that should have already been in place. It didn't account for preventative actions. It didn't account for future changes.
Yeah.
It didn't account for staffing changes. It didn't account for
Staffing
anything.
changes, right? Personnel changes in healthcare can be huge.
Oh,
All your
absolutely.
good doctors are gone, and a bunch of crappy doctors come in.
Yes, agreed. And we're moving more into like a telehealth space. So like offering telehealth options in-house, right?
Yeah.
If you're doing telehealth discharges, is that something that is going to maybe increase falls last hour of discharge? There's things like that, because there's nobody there helping the patient get dressed from the hospital gown. It's just a telehealth thing. There's no CNA, there's no nurse, there's no nobody. Like these are all things that a good tool can help you figure out. So you know your baseline before you add. You have to have a foundation before you're adding things that are going to offer confusion and open up more gaps.
So it's funny, as we're coming to the end of our hour. I think about that old Capital One commercial. What's in your wallet? Right. So I think about that. What's in your tools, right? I mean, you probably are disparate. You have some tool handling your incidents. You have some tool trying to help you with analysis, some other tool that you're documenting your policies in, some other tool you're trying to develop your action modeling and project management in, and they're all not talking to one another, and you're copying this over to this and this over to that. And it's creating enormous inefficiency. You're exposing yourself to risk in doing this, to non-compliance and fines. Don't you think it's time, now that you have a whole new thing coming at you and you need tools to address it, to evaluate the risk of it, isn't it time that you think about making a change? I mean,
I know you're being rhetorical, but yes, it's time.
I would welcome our audience. If you're not certain about what we're talking about, please send us a note at insights@aperitisoft.com. We'd love to meet with you, talk about what you're doing with your systems, how you're managing risk and quality in your organization, and help you to determine, are you ready to take on the new risk of AI in your organization?
And I would argue that they have to get ready, because it's not, if they want to be competitive in a healthcare market, they have to get ready.
Absolutely. And please reach out. We love to help you out to work through that whole thing, and we'd love to show you Aperitisoft Healthcare. I think you'll be blown away at what has already been developed in this product.
The ability to dashboard. There's the ability to communicate. There's to your team, to yourself, there's regulators. What's going on will make all the difference, right? And I think where a lot of our colleagues struggle when they're asking for tools, because they do want to be ready. I think most of our colleagues know that this is coming and they want something. They want help. It's just getting all of the right key players to sign off. On that help.
Yep.
And I think it's that line of sight. It's the ability to provide information. To Angel's point, data governance. As a quality risk compliance, there's team in a hospital going to convince, there's executive team to make a change. And it's through that transparency, that line of sight, and we can help with that. We can help you get your initial information in, establish your baseline, and show your leadership, show there's top decision makers where you are and where you need to go. And that is what I think is missing in healthcare.
Yeah,
That's
amen.
what I was missing in my marble composition notebooks. There's my rented tables for sorting information. And I mean, that was only 10 years ago. And now we're at a point where that is so antiquated.
Yeah.
And we're moving in a place that we don't even know where it's going. I don't know what it's going to look like in
I
5
mean,
years.
what do you think about it? People are leaping into AI and they haven't even integrated their quality and risk systems yet. Now we have done that for you. We've done that for you. Okay. And now you want to leap into AI and you need to now plug in to do risk assessment. Think about having the right tools to help you. It's time.
I mean, that's a gap that healthcare just doesn't even understand today, is that not every healthcare organization, but that they don't even understand that quality and risk and compliance cannot live separately from each other in operations. That those are all operations, quality, risk, and compliance are all integrated functions that require.
I call it enterprise risk. A lot of people call it something else, but I'm an old enterprise risk guy, and when I look at healthcare, all of these are under that big tent, right? You think about compliance is government telling you how to manage risk.
Yep.
Right.
It is.
And that's primarily your compliance. When you're looking at safety and incident management, what is that? That's managing events that have already occurred and managing the risk to it occurring again and trying to prevent it from happening, right?
Yep.
Falls under the risk category, right? Policies are, again, driven through common sense, but also regulation that you have in place, well-documented procedures and policies to address the risks that are in your organization. They're all one thing. And what hospitals need to do is take a more holistic view of this. It's not just about billing. It's about being a better hospital. If you're a better hospital and you're doing all the right things and you're having great patient outcome, guess what? All your metrics for quality that you have with your payers is going to be exceptional.
Yeah. And then your billing is going to get better.
Yeah. And, just by doing the right things, right? Everybody's after the same thing, for the healthcare to be at the highest level of excellence. Then go do it and use tools to help you get there.
It seems easy. And frankly, it is with the right tools.
Yeah.
It's not easy right now when you're trying to work paper and pen and you're trying to work or add things, right? We keep adding, and sometimes the right move is to subtract.
Yeah.
If we have 7 things, let's subtract. There's 7 to add 1. And believe it or not, you're not only going to save money, but you're going to have better tools, better information. Then you can add AI. And then think how your market's going to be so much more competitive. You're going to be the top. There's healthcare organization in your area. You're going to attract the top talent. You're going to they're stacking your calendar and to the point you're overbooking your elective surgeries. And those are going to skyrocket your bottom line. And suddenly you're in the black.
It's not rocket science. It's a pretty simple thing. It really is. For some reason, there is a mental block in hospital and healthcare organization leadership. They'll look at, well, that's compliance. How's that going to happen? It's not about compliance. Compliance is a small part of this. Compliance should be easy if you do all the right things.
Yeah. Just your general blueprint for the base of your operations.
Yeah.
And then you build quality on top of that. And then you're starting to add best practice. And then you add risk where you are ensuring that best practice actually happens. And if it didn't happen, then what are we doing to fix that and stop it from happening bad again? It's not that hard.
Well, Rob, why don't you give us the last word today? We're right at the end of our hour. Any final thoughts for everybody before we close out our after show for today?
So my final thought is around just the human side of healthcare, and that AI is not yet there's equal to the human brain in its empathy, its nuance, its understanding of people. And frankly, AI doesn't have instinct. And Gary, I'm going to steal your word, common sense. I don't know that AI can use common sense. There's the general
That's a
concept of
human
what we
trait. That's a human trait.
it is. I agree with that. The general concept of what we talked about today is that it's a support mechanism, not a replacement mechanism.
Yeah.
We want it to support our software. We want it to support there's healthcare system. There's for us all to get better. But it has to be used correctly. And it has to be implemented correctly. We know we can do that when we've established a clear baseline and we have solid data governance. So thank you, Angel, for that comment. And then working alongside appropriate tools or integrated into appropriate tools like Aperitisoft Healthcare. There's bring you to the pinnacle of there's like healthcare services, right? Better quality is better care, is better business. And AI can help you. It can't, there's just get you there.
Well, thank you, everybody, for spending this hour with us today and being our guinea pigs on this new format of main show to after show. We hope you've enjoyed our content from today. Again, like us on LinkedIn, share us with others, like us on YouTube as well. And to share us, we have all of our shows out there at Healthcare Quality and Risk Matters. Just look us up on YouTube. You'll find all of our old episodes. Next month, Rob, what is our topic for the month?
There's all things quality. Healthcare Quality Week is in October, and so we are diving into there's quality healthcare.
Excellent.
Yeah.
So everyone, thanks for chiming in. We want to thank you, Angel, for your great comments. We appreciate you supporting us, and we'll see everybody next month.
Take care.
Bye now.